Alright, to get this critique started off, we're going to state our drug knowledge. We have cefazolin. It is available per orally, IV, and IM. The classification of it is an antibiotic and an anti-infective. The IV onset is immediate but can take up to 10 minutes. The peak is immediate but can take up to 10 minutes, and the duration is unknown. The dosage range is 250 milligrams to 1 gram, and the maximum dosage is 12 milligrams in a 24-hour period. It is used for respiratory infections, surgical prophylaxis, UTI, genital infection. Some of the nursing implications is to assess for antibiotic and penicillin, and the patient is not breastfeeding prior to administration. During administration, that the client is free of phlebitis, inflammation, the bag is clear, there are no kinks or leaks in the line. We are post to assess urine output and creatine levels. And some of the adverse reactions to this drug are nephrotoxicity, renal failure, rash, vomiting, and nausea. Alright, so now that we've done this, we can now state our 2 policies that are relevant. And what we are going to do is we are going to open the chart and we are going to sign in with today's date, 24/03/20. Mike Pandiak, SPN 3, and there's my signature there. So there's today's date, there's my name, there's my initial. Okay. And then from here, what we're gonna do is we are going to take the doctor's order and the MAR, have them in our hands, and we are going to compare the two. Okay, so we have Sid Garland, 344316, 344316. Okay, we have the date of birth of 11/08/1965, 11/08/1965. We have an allergy to penicillin and codeine. We have an allergy to penicillin and codeine. We have cefazolin. We have cefazolin. We have 500 milligrams. We have 500 milligrams. Okay, everything's matching so far. We have the root of IV. We have the root of IV. We have the frequency of every 8 hours. We have the frequency of every 8 hours. We have the timing of at 2200 and Q8H. So the last dosage was given at 1400. So that meaning the next dosage is to be at 2200. And some special instructions are to take this medication for 7 days. Okay, perfect. Now that we've done this, we are going to grab our IV monogram, and we are going to refer to this for infusion time. And this medication can be infused for 10 to 60 minutes and can be diluted in 50 to 100 milliliters of normal saline. This medication will also infuse over 10 to 60 minutes. Okay, perfect. Okay, so in the doctor's order, it stated that the client was already on normal saline at a rate of 125 milliliters per hour. And based on that, the medication would be safe to give because cefazolin does not react to its normal saline as it is being mixed with that as a diluent. So as for our infusion time, we are going to choose 60 minutes because the client is allergic to penicillin, and that's one of the nursing implications is to assess for a client with penicillin allergy. So I'm going to infuse at 60 minutes. That way that if a client does have a slight reaction, it is only a minor reaction to a lesser drug amount rather than pushing an entire amount, infusing it over a quick time. Alright, now that we've done that, we are going to go back to our monograph and we are going to compare. Okay, so we have this that is compatible with a Y site. So cefazolin is compatible at a Y site. It's IV diluent, so yes, it can be diluted in normal saline. And the main line is normal saline itself. So So now that we go into our patient's room, we're going to assess the main line. So the main line is normal saline. It expires August 20th. It's going at 125 milliliters an hour. It's properly labeled. There's no kinks or leaks to the tubing. Everything looks good. The infusion rate is 125 milliliters an hour. In the site itself, there are no signs of inflammation, pubitis, or infiltration. So the site looks good, and I feel comfortable with. Oh, sorry. The expiry date. The expiry date of the medication is August 20, 2020. Okay.